Okay. All right. Brian, can you hear us okay?
Yes, I can hear and I can see your screen as well. See your presentation.
Perfect. Thank you so much. Well, first of all, we want to thank everyone from the conference committee and everyone who stuck around to join us today. Greetings from Buffalo, New York, USA, where surprisingly it is 85 degrees today, so it's a little warmer than usual, but at the same time, snow is still around the corner to greet us one last time in the spring. We just want to take a few moments and share with you all some developments relative to a pedagogical framework that Shauna and I designed for university level health sciences courses, simply called Beyond the Textbook. Again, my name is Dr. Dennis Daniels, clinical assistant professor for health services policy and practice in the Department of Epidemiology and Environmental Health at the University at Buffalo School of Public Health and Health Professions.
And my name is Shauna Zorich. I'm also a clinical assistant professor, also in the Department of Epidemiology and Environmental Health in the School of Public Health and Health Professions as well.
We figured it would be ideal to formally introduce ourselves before we get to talking about our developments. But what we hope to certainly provide you all with as far as information today is giving you understandings about the significance of experiential learning-based methods to accompany culturally responsive teaching methods at university level health sciences courses, in addition to highlighting experiences that Shauna and I have certainly had and facilitated over the last few years with our undergraduate and graduate level public health and health services courses. So to be more explicit, we're looking at courses pertinent to Masters of Public Health students, Bachelors of Public Health students, as well as courses that extend to various other dimensions of health sciences, which include pharmacy, health services from a case management or social work standpoint, and medical education. We also want to leave you all with a few identified pedagogical strategies that can be adopted and facilitated in the classroom that are more culturally responsive, but certainly have that interactive component with summative assessments that make it a little bit more experiential based as far as the learning approach goes as well. So what does it mean to go beyond the textbook? What we're largely describing here is a union between inspiration by Dr. Geneva Gay, as far as culturally responsive teaching is concerned, and Dr. David Kolb's experiential learning cycle, respectively. So essentially what we're describing here is a union of cultural responsive teaching, teaching that's centered on cultural characteristics, experiences, and perspectives of a diverse student body applied to a course learning environment that is certainly facilitated to stimulate decision-making and opportunities to build on management skills. So, you know, this is incorporating the needs of accommodations for an increasingly diverse student body, as well as certainly making note of a growingly increased diverse array of patient populations. So it's incorporating cultural responsiveness, an interaction component, and often reflexive assignments that allow students with an opportunity to not just go through experiences that will build them critical thinking and management skills, but also apply opportunities to reflect on those experiences to lead to innovation and certainly accommodations certainly considering cultures as they're moving and progressing through the workforce post-commencement, excuse me.
All right, so now we're going to talk a bit about why we are going to be trying to go beyond the textbook in our classrooms. Here we go. All right, so one of the things that Dennis just mentioned is the increasing diversity that we're seeing in college campuses. And so what we're looking at here is we're looking at some data that's showing us college enrollment rates for college age students. And we've seen some significant gains in the number of college age students that are enrolling in colleges among a number of different populations, including our Hispanic population, so significant strides there. We have 36% of our Hispanic college age students that are now enrolling in school, up from 26% in 2000. Also see gains in American Indian and Alaska Native populations, currently 24% enrolling, up from 16% in 2000. And then we've also seen some gains in African American students. So currently at 37%, up from 31% in 2000. And so it is great that we're seeing this increased diversity in our college and university classrooms, but we are also seeing attainment disparities among historically marginalized populations. So we have some data from the American Council on Education, and they have found that African-American students have higher undergraduate dropout rates. They're also more likely to take out loans, and they're also most likely to have the largest debt burden. So our average debt for a graduating undergraduate student is $18,000, where our Black students owe an average of approximately $22,000, so significantly more. So this is very important. And then what this is looking at is it's looking at graduation rates within 6 years from their first institution attended for first-time college students. And we see disparities again when we look at these graduation rates by race and ethnicity. So this is data from the US Department of Education, and they have reported that Asian and white students, they have the highest graduation rates at 74% and 64% respectively. But we see the lowest rates among historically marginalized populations, specifically only 39% graduating among American Indian and Alaska Native populations, and only 40% among our African American students.
So you have about 2.5 minutes left, roughly.
So our problem is that we believe that traditional pedagogical approaches that are really teacher-centric and textbook oriented fall short, and they really fail to address various factors related to our students, such as cultural diversity and the economic challenges that some of them face, in addition to neglecting the evolving health science landscape that we currently operate in. All right, so I'm going to turn it over to Dennis for our solution.
Thank you, Shauna. So when we're talking about the problem, as you understand, we have an increasingly diverse student body and an increasingly diverse array of patient populations, which really leads us to understand that we need to restructure the way that we provide care to patients in the United States. Certainly considering the US Census Bureau conjecture that by 2045, we'll see an emergent majority or an emergent minority, depending on the way that you prefer to describe that. And so this is causing us to be more innovative in the classroom. And so the solution largely is providing, or rather facilitating, a learning environment that stimulates critical thinking and certainly building management skills, but also reducing the conventional approach to education that's centered in just acquiring conceptual knowledge and really building more on the aim for teachers to serve as facilitators as opposed to sages of the stage, keepers of knowledge. And so increased accountability on students, sure, but also as Matthew Lynch described in one of his editorials, we're wanting to see an increase in problem solving but certainly centered on a real world or realistic context. And so that is where a culturally responsive approach to teaching and educational facilitation is critical. If I can take a few moments and just unpack takeaways from both of the frameworks. Kolb's framework, known as the learning cycle, really posits that genuine knowledge is acquired from experience. And that's really taking into consideration and reaching some level of stability or attainment in being actively involved in the concrete experience, being able to reflect on experiences with existing conceptual knowledge, but also being able to build on that by generating new ideas from reflections about what it's like navigating those experiences. As we all know, life is unpredictable. It's an ever-changing process for each individual navigating life. And so being able to adapt to those unexpected changes are very critical. So we certainly need to think beyond the concrete experience and reflective observation, but also consider active experimentation, applying new ideas based from reflection about navigating those experiences. And then paired with that, considering Dr. Geneva Gay's framework, where just summarizing this, we're utilizing the cultural experiences and perspectives of a diverse collective of students to really facilitate the learning environment. So being centered on marginalized voices and not necessarily being married to conventional Eurocentric heteronormative perspectives that are previously and traditionally noted in your average American textbooks. We really need to be able to think beyond one dimension of the human experience and be prepared for multiple perspectives, multiple understandings of health, and multiple understandings of how to acquire wellness. And so really, it is a union between experiential learning and culturally responsive teaching. Amity and Shabazi both had a wonderful study that looked at how critical thinking and problem-solving attainment in nursing students really led to improved comprehension of conceptual knowledge, but improved application in realistic settings. We believe this is ideal for all sectors of the healthcare workforce, and so that includes public health as well.
So I don't see Patrick here, but you know, you're beyond the 10 minutes, so maybe just wrap it up and we can, if people have questions, then.
And you know what, if you've got questions, you can always jump in and we can throw in answers as we're navigating as well. We're a pretty casual bunch.
Mhm.
I'm just going to give a couple of examples of how we might try to integrate this into the classroom setting. And so on this slide, we see a list of activities and assessments that both Dr. Daniels and myself have utilized in our classroom. And what we really want to do is we want to take our experiential and our active learning classroom activities and assessments, and we really want to infuse them with our culturally responsive components. So for example, you can take a reflection assignment where you're asking a student to reflect on, say, an article that they have written. But then what you can do is you can take it one step further, and you can ask the student to, when in their reflection, think about their personal background, their personal lived experience, and how that applies to what they're learning. You can also do that with the Think, Pair, Share tool, which we use in classrooms a lot, where we're asking students to think about a particular question or topic on their own, and then they turn to a classmate and they pair it with a classmate and talk about what they were thinking about, and then they can share out to the entire classroom. And so this is a really great way to get students actively engaged in the classroom, but you can take it one step further and ask students to think about how their own personal experiences have impacted their understanding of whatever it is that they're whatever question they're asking or whatever it is that they're reflecting on. And then we have a couple deeper examples of classroom applications. I don't know if we have time to discuss these. Okay, so we'll just kind of.
Maybe we can open it up for, does anybody have any questions on anything so far? I mean, we have extra time since Patrick McGuire isn't here, but just want to make sure.
And I obviously don't want to take up anyone else's time.
Well, you're the last presenter since Patrick isn't here. So if there are no questions, if people don't object, you can continue on.
Okay, well, we're gonna go ahead and jump to our conclusion. So briefly in conclusion, we recognize that university student populations are changing and that conventional teaching methods do not adequately address these changes. So we recommend improving student learning by centering our health science courses on culturally responsive and experiential-based teaching materials and methods to improve learning. And we call this going beyond the textbook. So we have just a few individuals that we wanted to acknowledge, and then these are our references. Anyone has any questions, we'd be happy to take questions.